there.
We're just going to wait a little bit and get people on board. Hi,
Okay.
Dale.
Hi there.
Robin's got some family stuff this week,
Yeah.
so I'm going to be hosting.
Awesome.
And Dale's just joining us as a listener this week, which we're giving.
Know. Big vacation.
Well, we figured you probably needed a little break after doing this for how many years now?
A long time.
Just 3. Yeah.
That's great. Oh, I have a plane taking off. I'm going to mute for a second. Okay, so yeah, we're excited. This is going to be an interesting talk that Chris Price is going to give us this morning. And we're expecting a lot of questions about vaccines. There's a lot of information out there. So I think I might just get started and we can just, Ashley's going to keep letting folks in for us. So you all know me. I'm Beth Droppert, the Vice Chair of HealthAdvocateX, and I'm going to first do our land acknowledgement. HealthAdvocateX is headquartered in Seattle, Washington, and we acknowledge that we are on the traditional land of the first people of Seattle, the Duwamish, people past and present, and we honor with gratitude the land itself and the Duwamish tribe. We invite you to join us in acknowledging and thanking Indigenous people for their ongoing stewardship wherever you are located. I also want to just talk about this as a safe space. We'd like to establish this meeting as a safe space, meaning every voice will be heard and respected. We enter this with different lived experiences, and we recognize the potential for unintentional harm, and we're committed to healing should harm occur. I also want to, I think Ash put it in the chat, but remind you that if the meeting is going to be recorded, and people, you should turn off your camera if you don't want to be included in the recording. So today we have Chris Price, who's one of our board members, speaking on about vaccines, actually that vaccines are not just for kids. And Chris is actually, he's a physician and is the founder of, I should say retired physician, founder of Call Dr. Chris, which is a health advocacy consulting firm. He practiced cardiology in Seattle for over 15 years at both the Everett Clinic and Evergreen Health. He retired due to medical issues, which he feels gives him the unique perspective of both patient and provider, and he uses this in his advocacy consulting. So I'm going to turn it over to Chris. Remember, you can put questions in the chat. Chris, if once he's done presenting, you can certainly just raise your hand and we'll take questions as they come in. All right, Chris.
Nice to meet all of you. Thank you, Beth. Just to let you know, I also tend to do this kind of more free flow. So if you have questions that are simmering, you could also ask them and just interrupt me. I'm more than happy with that. So that's just to let you guys know that. I thought I would also give, kind of, since we're giving Dale the break, just a little update on some of the stuff that's in the news about infectious disease and kind of things that can make people worried. I'm going to leave COVID until I actually get to the vaccines, just because it's a long topic with that. But recently you've been reading the news that malaria has been reported once again in Florida. There have been at least 4 cases that have been diagnosed. Is this something to worry about? At the present time, if you're going to Florida, it's with only 4 cases documented. It's probably not something where you need to take anti-malarial drugs, but it is something just to watch for, and it might become a problem. The United States actually was endemic to malaria up until the late 1800s, and most of what it's caused by is if we get rid of standing water, that usually takes care of the disease itself because it stops the cycle of breeding. The other thing coming out of Florida is also leprosy, which we think of in terms of ancient disease, but it is still present in the still present in the world. Strangely enough, this is only in Florida right now, and it's spread, or the vector, that, as we call it in medicine, is the armadillo. So it's a strange thing. So it would be places where armadillos are present, but it does take a long exposure. And at this point, even if you travel there, most likely it's not going to be a problem. So I would not be overly concerned about this at the moment, but always remember, if you have traveled to Florida at present, that'd be something. If you have a unusual skin disease, you should tell your doctor, just so they can know.
So Chris, how many cases of leprosy? Like, because
I haven't seen the official numbers. They just
Fine.
said that there's been an uptick. I know of 20 that I've seen, but I don't know if there's more. Florida is not known for releasing its information to the national databases, so it's hard to say.
okay.
So I wish I could give you actual more numbers, but
I know that's okay.
that one I can't. So those are kind of the big things that are going around, besides COVID, which I said I would talk about when I get into the actual vaccines. The reason I decided to talk about vaccines is, one, I think that they are one of the greatest gifts medicine has given to humans to prevent things. There are, many side effects that people get from diseases, even if they don't cause problems, like childhood chickenpox turns into shingles as we get older. If we get vaccinated for that, we could actually prevent shingles, which, a classic example of what shingles can do is look at Dianne Feinstein, who was out of the Senate for over a year because of dealing with post-herpetic neuralgia, which is a long-term neuralgia that happens from the shingles, and it's very debilitating and very painful. So if we can actually prevent people from getting the initial disease, you can prevent the follow-up diseases that occur with age, and that's what vaccines can do. So it really improves quality of life and length of life for mankind, and that's part of the reason why I wanted to talk about these vaccines. And they're not just for kids. We think of them as, oh, kids are going back to school, they need to get their shots to go back to school and so forth. But actually, to keep ourselves healthy and things, as we've seen with COVID, we actually need to have some vaccines too. So in terms of, I broke down which vaccines are needed per age group and also certain special diseases, but there are 3 that have been deemed, and all this information came from the CDC. Just so you know, that's where my resources came from. It's exactly the CDC's recommendations. And some of them, I'll tell you where they're gray, and I'll tell you where they're absolute and all that. But just to let you know, but there are 3 main vaccines that they say all age groups from the age of 18 and up that every adult should have. One is a yearly flu shot. And the flu shot, there are several different types. There's the injection and there's nasal spray. Nasal spray is good, but there are contraindications to that. Children under the age of 17 cannot get it. If you have asthma, you cannot get the nasal spray. If you have had your spleen removed, either for medical reasons or from a trauma, you cannot get this. If you are pregnant, you cannot get the nasal spray. And also for people over the age of 65. So those are the things that usually when you fill out the form, either at the pharmacy or wherever you get your flu vaccine every year, they ask those questions, and that's why they're asking, because you cannot get the nasal spray, which is a lot easier. The nasal spray is actually a live virus, which is why you can't get these things, where the other is pieces of the virus proteins, which the injection is, and that's the reason for that. The other one, the second of the 3 is DTaP or DT, which is tetanus, diphtheria, and whooping cough, or just tetanus and diphtheria. Tetanus, this should be given every 10 years, or if you've not had it, you should just get it. But it's something just to prevent things. In the last 10 to 15 years, there's been a resurgence of whooping cough, at least in the state of Washington. And if you've ever heard that actual cough, it is scary enough to get you to have the vaccine itself, because you really sound like you cannot breathe. And that's one of the biggest things. And also for young kids, so you want to protect it because kids under the age of 1 cannot get the vaccine. So that is just also protecting those that can't be protected, that can't get the vaccine itself. Tetanus, has lockjaw, which is the most common form. It causes muscle spasticity. And diphtheria is a bacterial disease that occurs in overcrowding. It tends to happen. There's a surge of it usually if there's a breakdown, like with Hurricane Katrina and things like that. There was mild outbreaks of diphtheria for those that were not vaccinated. It's a bacteria that's passed. It usually infects the nasal passages and the lungs. And you get a gray membrane that forms, and that's what prevents people from breathing. And you can die from suffocation, basically. And so, and the other one thing that they do recommend is for pregnant women, if they've not had their DTaP or DT, somewhere between the 27 and 36 weeks while they're pregnant, that's when they should get it if they haven't had it, because it actually passes immunity on to the unborn child. So that's just.
And normally, though, kids get this at what age?
Like 6 months or older.
Yeah. Okay. And do schools now still? I know this is a political question, but require it? I mean, and normally
every state is different, and I'll just leave it at that because the religious reasons not to get, and whether or not you just personally don't believe in vaccines, every state is different in how they deal with this. So I really can't comment.
Okay.
And then the final one is everybody should have their COVID vaccine. And what I mean by COVID vaccine, if you're under the age of 65, you should have the first 2 monovalent shots, which were the ones that came out originally, and then 1 bivalent for the Omicron, which came out last year. Those are the 3 shots that the CDC says everybody under the age of 65 who is not immunocompromised, who is not has some other illnesses that require it, that is being fully vaccinated. Unfortunately, most of the United States, 70% have had 1 shot of the monovalent that came out originally. 50% have had the second shot, and only about 40% have had the bivalent. So approximately only 40% are fully vaccinated per the CDC, which is a little unfortunate. If you've not received any of those in the original monovalent ones, the CDC is recommending that if you want to get vaccinated, it's 2 shots of the bivalent of Moderna or 3 shots of the Pfizer bivalent, and that would get you fully up to. And the thing with bivalent, just so you know, the difference of it is that the bivalent shot actually has the original COVID vaccine, which will start antibodies forming for that, and then it also has the Omicron. So you have both that you're getting things. Over the age of 65, they are suggesting that you get a shot once a year, no matter what, and you should have the 3 shots. Plus, you probably should get the newest one, which will be coming out in October. But I'll get to that in a little bit more because I wanted to talk about just the way the body actually makes antibodies before we get into all the different kind of things of what recommendations are and things like that. So when we actually have a virus or a bacteria or some kind of pathogen that comes into the body, the first response the body makes is it goes through a large cascade. And the first antibody that's formed is IgM. And there are actually several forms of antibodies. We call them Ig, and then the M or G or A or D or E determines where and what they function as. IgM is the first response of antibodies for anything that's developed. That usually will start forming about 5 to 10 days after the body has seen enough of the pathogen in the body. And so you've got a 5 to 10 day lag before any antibodies are formed. And that will peak at approximately 14 days. And so you'll have the full level of antibodies to go against this. This is, and then after that, it will switch either to IgG, D, A, or E. A and E, A is in the mucosal layer, E is usually for allergies or parasites. And IgD, we have literally no idea what it does. It's there. We don't officially know exactly what it does completely. And then IgG is the one that everybody thinks of having immunity, and that's the long-term immunity that you get. And IgG starts about 14 days once at the peak of IgM, and then that peaks at 21 days. And then will drop after a certain period of time if there's not more exposures. The nice thing about IgG is that if you have a secondary exposure after a period of time after the levels have dropped, 2 to 3 days, it will peak again. So that's kind of the overall lasting immunity that we have in terms of these things. So that's kind of the part. And if you look at those days, that's kind of like if you think back to when COVID first started, we had all the people getting sick with no vaccines present. If you think about it, that if the IgM or the first antibody being formed is 5 to 10 days out and peaks at 14, you've had the disease for 14 days. And it's already has ravaged your body and put you being sick. Whereas if you have the vaccine and you have the IgG already, it's 2 to 3 days of being sick with that illness. So really what this does is what we found is that vaccines don't always prevent people from getting the disease, but it reduces their risk of dying, and will also reduce serious hospitalizations. So if we go back to COVID right now we're seeing an uptick in the COVID numbers, but we're not seeing an uptick in the ICU admissions, and we're not seeing an uptick in death. So the vaccines are working, and so that is a plus. Do you get sick with it, and do you have symptoms? Yes. Do some people need to be admitted for low-level oxygen to help them breathe? Yes, but they're not getting to the serious where they have to be intubated, put on a ventilator, or dying from it right now, which is the main reason why vaccines are so important. And a lot of people think that, you'll hear people say, well, I got the flu shot, and I still got the flu. Well, yes, but did you get admitted to the hospital for it? No. Did you die from it? No. The vaccine worked. And that's kind of a different mindset that I think most people have to have, that it's not going to prevent the disease, but it's going to prevent you from getting seriously sick or dying from it. And that's kind of the main focus of what I really wanted to say, why vaccines are not just for kids today. So in terms of getting back to one of the questions I saw about COVID for people over the age of 65, if you're 65 or older or have health issues, that is a discussion that you have to have with your personal doctor. Most likely they're going to recommend getting more shots. Do you need 4 or 5 or 6 shots? That's between you and your doctor to determine on your individual healthcare needs. But per the CDC, if you're under 65, it's just the 3 shots and all that. So I hope that answers that question.
Thank you.
And
It
it's
does.
very confusing. I mean, I was telling Chris, I went to my PCP and said, okay, should I get the next booster? And so she had a long conversation with me, but still said, well, not sure, maybe wait till October. And so I think it's not clear, even, it just is sort of a personal decision with your physician, depending on what your health risks are.
And then in terms of the new shot that I just saw an article in the paper today talking about the new one coming out from both Moderna and Pfizer for this year. There's a lot of debate going on, even amongst the elite educated people in this field at the CDC within itself and the NIH, that we're uncertain as to whether or not the vaccine will actually be a good thing or be needed or not for those under the age of 65. Because right now the uptick, the main source of this the new variant, which I'm blanking on, it's as IRSA is the new variant that they're talking about. It's the dominant one, but it's only 14 to 17% in the United States right now, and that's the dominant form. And the CDC and the FDA have made a thing that it will only be a monovalent one, so it will not have the original COVID virus to give antibodies or give immunity for. It's only to this new one that it will give. And it's uncertain if it's only 17 or even if it's 25%, is that enough to cover everybody to prevent them from getting it with the other variants that are out there? The good news is that all the variants that are out there right now are from the Omicron. So that the bivalent one that we received last year still works some extent. They have changed their surface proteins a little bit, which is what the antibodies attack and the body acknowledges as being foreign. So it does work. It just might not work as well. But we don't know if this one shot, is it worth giving it for only 17 to 20% of those infections? Is it going to help the other? So that's the debate going on with the people that know the most about this. And I just want to say that it's just unknown. And the more we wait, the more we'll see. If it gets to be more prevalent in terms of its dominance, then most likely the recommendation will be to get it at that time. But I think wait till October and we'll have more information. We have a couple more months to see where it goes. So those are the three main vaccines that the CDC recommends for all adults. If we break it down into age group, we have the first age group is 19 to 26. That's just the way the CDC broke it down. They should be vaccinated for chickenpox. They should have COVID. They should have the flu. They should have the hepatitis B series, which is 3 shots. They should all have HPV. They should have their MMR series, which is also 3 shots. They should be up to date on their DTaP and DT. And then the CDC doesn't recommend this as for everybody, but I personally do, and certain states actually require it. When I was in residency, there was an outbreak in Portland of bacterial meningitis. And if you've ever seen a person have bacterial meningitis or survive bacterial meningitis, you will want your kids to be vaccinated to prevent that, because you lose the tip of your nose, your ears, your fingers, your toes, and that's if you survive. And there's a high level. The state of Massachusetts actually requires that all kids going into college be vaccinated for meningitis B. Luckily, my kids went to school in Massachusetts, so I didn't have to fight with them, but they were going to get it either way. But when I was going through medical school, they actually, the infectious disease rotation I did, they said especially kids in college and military recruits should get meningitis B vaccines because it really happens in confined spaces and it is very contagious and things. So I personally like to add to this age group that those kids going off to college or going into the military should get the meningitis B vaccine with that for those reasons. If we look at the age group of 27 to 49, chickenpox is recommended for those if they're born after 1980. HPV is recommended for those between the ages of 27 and 45. And the biggest thing I think what we need to realize about HPV is that it's been touted as a sexually transmitted disease, and it is to some extent, but it also is the #1 cause of head and neck cancers in people over the age of 30. It's related in there. So that's the part that I like to stress to people is that if you can prevent cancer with a vaccine, why not? Same thing with with hepatitis B. The reason to get that, besides being hospitalized, is that you actually can prevent liver cancer. But with HPV, it's not just cervical cancer. I mean, yes, it will prevent cervical cancer in women, but it also prevents head and neck cancers in men and women. And I think that's something that most people don't realize. And I think it's a very important thing to have that age group vaccinated for. COVID, flu, hepatitis B, the 27 to 49 basically is identical to from 19 to 26, where you have the flu, hepatitis B, the MMR, and the DTaP. When we get to the 50 to 64-year-olds, it's COVID, flu, DTaP, hepatitis B, and then shingles. And the reason for shingles is you want to build up, we assume that the age group from 50 to 64 has already had chickenpox as a child. So
Mhm.
you have the virus. And what happens with that virus is that it will go into one of the nerve roots in your spinal column. And we don't know which one, but it will go anywhere from the very top of your spinal column to the very bottom of your spinal column and pick one spot to stay. And when you have a reactivation of that, which is called shingles, it will come in one nerve distribution from where it set up home and hibernated for all those years. The thing for the shingle shot is to keep that immunity up to prevent it from opening or from the immunity waning, and it will then spread and cause, basically shingles. And then 1 out of 4 people with shingles develop post-herpetic neuralgia, which is a chronic painful situation, which if you've ever talked to someone with it, it is extremely painful where people are not happy. I mean, shingles is not fun by itself, but the post-herpetic neuralgia, which is basically the nerves in that distribution are on fire all the time.
That's really painful.
Extremely painful. And if we can prevent that, which prevents, decrease in quality of life, decrease in working, all that stuff, it's very, very important. And then in terms of general parts with 65 and over, COVID is recommended, the flu is recommended, the pneumococcal vaccine is recommended. And what pneumococcal vaccine, that's a pneumonia shot. That is only for pneumococcal pneumonia. It's a bacteria. It is the bacteria that caused the death of Jim Henson, who did the Muppets.
Mhm.
It is a bacteria that once it gets into the system, rapidly progresses to a serious form of pneumonia, and it can cause death within 3 to 5 days, which is what happened to Jim Henson. Does it prevent you from getting pneumonia from other viruses? No, it's just that one type of bacteria, which is pneumococcal. And there are 23 different forms of that bacteria, at least last time I checked. But that's the reason to get the pneumococcal, is just to prevent that, because it can prevent death from that. They also recommend shingles and DTaP for that group. Now, there are special medical conditions that they also recommend as adults that you get vaccinated for these. And these are based on the special medical condition that the CDC actually has specific recommendations for these people. People that don't have a spleen, either from not being born with one, either having it removed, should, in addition to whatever age group that they're in, should also get the Haemophilus influenza B vaccine, which is typically one for children, the meningococcal and the pneumococcal, or the pneumonia shot and the meningitis shot. Those are the 3 that they recommend for people without spleens. And preferably you'd like to get those vaccinated before you remove the spleen if it's with a trauma. But if not, you can do it afterwards, and you might have to have boosters along the way. But that's something that you can speak with your specific doctor if you for those individual cases.
Could you say the first one again, please?
Haemophilus influenza B, or HIB.
Or HIB, HIB?
HIB.
Okay. Great.
It's one you hear a lot. Kids get that starting at age 6 months, and they get a second one at 1 year. And it's just a specific type of bacteria that causes problems.
Chris, can you just real quickly explain why the spleen, like why, what if you don't have a spleen?
Yeah, so basically the spleen is a very large lymph node, is kind of the easiest way of looking at it. All the blood goes through it, so it circulates through. It is where a lot of lymphocytes, plasmacytes, which are the specific white blood cells in your blood that produce these antibodies and produce your immune response, all are stationed in the body in one major location. They're located elsewhere also, but there's just a high concentration in that area. And so without the spleen, if you remove that, it just doesn't work as well.
Thanks.
So for people with diabetes, they recommend also getting pneumococcal no matter what your age is. If you have a history of a heart disease or a previous stroke, no matter what age you are, they're recommending a pneumococcal or the pneumonia shot. People with liver disease should have hepatitis A, B, and the pneumonia or pneumococcal. The reason for the hepatitis A is just your liver's already damaged. Any damage caused by that infection, even though it's 99% survivable, it's just best. People with end-stage renal disease or on kidney dialysis should have hepatitis B and the pneumonia shot. The reason for the hepatitis B is just to prevent getting hepatitis, because that's the most common cause is from blood transfusions. And that's just one of the things. And the dialysis units, even though they try to sterilize them as much as they can pass on hepatitis B or C and things like that. And then transplant patients, which was a one, they also recommend getting the Hib or the Haemophilus influenza B, the pneumococcal, the meningococcal, and the shingles vaccine. They didn't say how often you should get those. That's going to be an individual thing with your doctors, but probably not just one series. It'll probably be on a recurring basis every 5 to 10 years or every year, depending on how immunocompromised you really are. So those are the recommendations from the CDC. And I made this short because I figured there'd be a lot of questions.
Well, and I see there's a question about the reaction to shingles vaccine, but I'm wondering just in general, vaccine reactions, because a lot of people shy away because they say, you're going to have a reaction. We all know about COVID, but maybe you can address Beth's and then other.
Well, the shingles vaccine actually has something to increase the body's immune response to the vaccine itself, which is why it is more painful at the site of injection and lasts longer. Similar to the tetanus vaccine, everybody remembers getting tetanus as a kid or previously where your arm hurts for a day or two. Shingles vaccine, they actually upped that by not just having the arm thing. You could also get similar to the COVID vaccine where you get fever, chills for 24 hours and then it goes away. But that's just to increase the immune response to it to prevent shingles from happening. And that's the reason why the shingles shot has that thing. Most common side effects is soreness at the site of the injection, redness at the site of injection, flu-like symptoms, but they should only last for the first 24 hours.
Yeah, so Beth's question is, she says, shingles, I'm concerned about for the protocol of administering it, particularly for people covered by Medicare. It's covered by Part D, so one has to get the vaccination at a pharmacist. When I got my second shingles vaccine, I got very sick. The pharmacist had not given me information about common reactions, nor did she give me any documentation that I received the vaccine. Also, there's no one to call if you have a reaction. I'm capable of looking up on the internet, but some folks aren't. What can be done to improve the standard of care if pharmacists are going to be doing the vaccinating?
Yeah. There's a lot there.
Yeah.
What I would recommend is that every time you get a vaccine, especially at a pharmacy or even at your doctor's office, is always ask, what are the common side effects? Have them print out for you because it's on the web very easily, and they should have them easily available in their doctor's office or at the pharmacy to print those out. And go through it and ask your questions before you get the shot. And because really what you're trying to understand, this gets into what I consider consent for getting the procedure per se, which is getting a vaccine. They have to tell you everything. They have to answer all your questions. You have to be fully informed. But a lot of times that doesn't happen because either they don't have the time to take the time, or they don't want to take the time, or they think they're going to hand out something and they forget. And there's a lot of reasons, but I think you should always ask as many questions, especially what are the side effects you're going to get and what are all those things. So that's the best I can answer for that one.
And Annie asked if we could send out the list that you were just going over
Yes,
about.
I'd be happy to. Actually, yeah, I'd be happy to. I will have it all typed up and send it out, and we'll send it out to you guys and all that.
Great, thanks.
Scratch notes are welcome. I didn't mean to create more work for you, but I
No,
scribbled
no,
as
not at
quickly
all.
as I could.
Not at all. No,
Thanks,
that's okay.
Chris.
Any other questions people have?
I guess I'm curious, because we live in Washington State. Do you know what I mean, are we any better? I assume we are at COVID, but in general for vaccines?
We're in the lower third tier of the country.
Wow.
Because a lot of the exemptions for the longest time, the exemptions of not getting vaccines, even for your kids in school, was your parents signed a form and that's all you had to do. You didn't have to have a doctor's note. You didn't have to have a discussion with the doctor, and all that, either for religious reasons or personal reasons. And I know this personally because we had a foreign exchange student for 3 months, and she was from Finland, and she was really concerned about getting vaccines and things of that nature. And my wife and I only had to sign the form, and she didn't have to have any of the vaccines to go to the local public high school.
Wow.
So that's the reason why we're in the lower third.
Huh. Well, and I assume colleges, it's similar. They're not required.
It depends on the state. Like I said, with my boys going to school in Massachusetts, they had to show proof of their meningeal or the meningitis vaccine before they could even go to school there. So it's just state by state, unfortunately.
Yeah, that's crazy. Well, and the other problem in colleges, as you probably know, and lots of people know, is if they're 18 and you want to talk to somebody about what's going on there, you can't. I mean, you have to have a HIPAA release. So
it's 13 actually.
Oh, really?
The 13 parents are not allowed to. The child can ask the parent to leave the room, and the doctors will give it. It's the reasons behind it is for possible physical or sexual abuse, which I totally agree they should have that open time. But at the same time, if parents do need to, in some respects, need to know some of this stuff too. So there's a conflict that it's hard to balance this stuff out.
Yeah, and I'm just curious if the CDC, like, how does this get out? Like what the recommendations are, and then, how do people understand? Like, I mean, I didn't know a lot of these age group recommendations, but I'm not sure how people get the information. I guess you have to go to look for it. It's not being, distributed.
You need to go to look for it. You also should, this is part of the thing where if you go back and have a yearly checkup with your physician, this is some of the stuff that should be either prepped in the pre-office material, I feel, because at least now with the digital age, we can send this off with all the paperwork you have to fill out online before your doctor's appointment, and just say, look, these are the vaccines. Let's talk about these. If you have any questions, let's talk about these at your yearly appointment. I think that would be a great place to get the information out to everybody.
And Dale, not to put you on the spot, but I'm just curious, as an OB, GYN physician, is that addressed during pregnancy? Like, is that something that's?
Oh, totally.
Yeah.
Because actually we were very aggressively counseling patients before, or there were pockets of people, I guess I should say, who were counseling people about vaccination in pregnancy with COVID. before American College of OBGYN and Society for Maternal Fetal Medicine came out with their strong recommendation to get it, before that. Any provider who was supportive of vaccination, not all providers are, was counseling the wisdom of that, because we know that almost every viral disease in pregnancy is worse for the mother and potentially a harm for fetus. And we didn't know COVID specifically at that point in time. But once the vaccinations were available in Washington State, at least, and on the west part of the state and in the key urban areas, for sure, that conversation was happening. Mm-hmm. So there are all the standard vaccines that the hepatitis B vaccine for the newborn, all those things should be discussed in the third trimester before birth. And that is pretty routine with folks. So yeah, I think how aggressive any individual office might be a little bit different, but it is built into the prenatal care bundle, and it's also built into what was the ideal prenatal care bundle that we worked on in Washington State for the Department of, not for the Department of Health, for the Healthcare Authority, the Medicaid coverage folks. So yeah, we're pretty good at that, and pediatric care is very good at talking about vaccinations. Most families are offered the initial Hep B vaccination for their baby before they leave the hospital. Some people choose to wait, but pediatric care providers are supportive of them getting started early. So all of that, I think we did a lot of work trying to get women who are hesitant to get vaccinated during pregnancy, vaccinated postpartum before they left the hospital. In some of the hospitals, this work was done. So yeah.
Thank you. And we have a question from Patsy Staw asking, keeping track of renewals and shot renewals is most difficult for me and my doctor. Is there a list at CDC, for example, of the renewal suggestion spans for each immunization?
There was not one that I saw right there, but with the new electronic medical records, that should be very easy to track at your doctor's office. And if your doctor's office is not tracking that, maybe find a new doctor.
Chris and I might be thinking the same thing.
Yeah. I don't mean to be blunt, but I will be blunt. Find a new doctor.
Yeah. But I am in the winter somewhere else and in a different system. And so I recently Googled, because my COVID card got so messy it didn't fit with the one they gave me, didn't fit all the, so I Googled and purchased online it's a little record, it's a little card, and it's a book actually, so you can keep adding to it to keep track of immunizations, because once you hit 65 it gets really complicated.
Yeah, it does.
Yeah,
I mean, it really does. And
I mean, I don't remember the name of that, Patsy, but I think they're definitely out there. But you also think you know what the CDC says. Yeah,
but I also think you could easily ask your primary care doctor, where you normally do. Ask them for a printout of what you've had, and they should have the dates and when it was. And you can keep that as a little card, either as a photo on your phone, since everything's on our phones nowadays, keep that way. And that way you can just show it to anybody you get there. I think that would be one of the best ways to do it.
Yeah. Beth Barnett put in Maryland as part of Immunet, which keeps the vaccinations online. And we certainly had tracking of COVID vaccinations in the state and federally, and then that's now the federal has dropped off with the Be Safe program.
We could learn a lot from vets, because my dog's vaccinations are really easy to find.
Oh yeah, they know. And the primary care providers all should know. If you're seeing a specialist, they may not be as on top of it. So if, for instance, a lot of women see OBGYNs for for their annual care because they don't have anything else going on and they're going for a GYN checkup or a pap smear or whatever. And the OBGYNs, and I am one, aren't necessarily that up on the
Yeah.
timeframes. We know about the vaccines, but for younger people, it's been less of a deal except for during pregnancy. But there are different timeframes, like the Pneumovax is every 3 years. It's not annually. So when it's not annually, it's really hard to keep track of.
Seema, did you have a question?
I just had a comment. I worked in a clinic in Portland for a year, but I'm based in Washington State, and that's where I did most of my career. And in Washington State, minors can consent to vaccines, so particularly the HPV vaccine. 13 years old, you can just get it. In Oregon, you have to be 15. And I, unfortunately, well, it's very fortunate actually, that I consented a 13-year-old and gave her a vaccine. And her parent was unhappy, but she agreed to it. But anyway, there's a 2-year age difference. So it's different in Oregon. And that's something important to know.
Yeah, it's state by state. Yeah. Beth Barnett found us a resource. She Googled about each state, and all states have a immunization information system. So she put that in the chat, the community guide. So thank you, Beth, for finding that.
Oh, well, it's good. It's good. It's in all states.
Yeah. Seema, did you have another question, or your hand just still okay? Anybody else? Questions or comments or?
Oh yeah, Patsy Stahl just commented. Yeah, the communication between pharmacists and doctors, that's a problem. I don't know how to address that one. I do think that Chris's recommendation to get information yourself and get a copy of what you had. I actually found that out with one of my COVID vaccines where it was hard to track and I had to go back and get the date. They looked it up for me and printed it off, but do it at the time and that will save you some hassle and you can start keeping track of your own record too.
I mean, the nice thing is too, I mean, I think everybody should have a list of their medications, no matter what, either on their phone or in their purse or wallet. I think you should have your vaccines when it comes to certain small. I mean, we've had to have the vaccine card for COVID if you're going to travel. So it's a little bit easier nowadays. It's not foreign like it was when it first came out with COVID. But I think it's something we could at least keep in mind. But those, and then a list of your doctors and who you are. I think everybody should have those 3 things with them at all times because it's just important because everybody has unique things and they could say, I mean, like a classic one that I used to see when I was practicing was, oh, I have an allergy to this medication, and the patient can't tell you what the allergy was, but then you call the doctor who actually had it written in their thing or their primary care doctor, and they're like, oh no, it's just a GI upset. It's a intolerance, not an actual allergy. So if that was the antibiotic that they needed or something like that, you could give it to them either way and do that. So I think those are 3 things I think every patient or every person should have on them as much as possible.
Yeah, it's really helpful when you're traveling for your vacation and they ask for any healthcare provider on the plane too, and the person who's on the floor has no medical records with them.
The new Apple Watches really help though. I'll have to say that because you can get an EKG printed out instantaneously. So
Oh, that's true. I didn't think about that. You just don't raise your hand, Dale.
No, I don't know. You sort of are obligated if nobody else. I always wait to see if someone else goes first because.
So, I mean, some of to speak to some of what people are saying about the lack of communication between pharmacy and doctors and not knowing what the CDC is recommending is, maybe the edge, it has to start with how we educate providers about this issue. I'm sure that's being discussed maybe in medical school and nursing schools, but I think it's a problem. I mean, the communication.
But it's also, I mean, the communication between the pharmacist and the doctor's office, I think, is something we need to work on. But if you have an electronic medical record,
Yeah.
those will prompt you to say, look, needs a flu vaccine this way. You need the pneumococcal. I mean, they actually are set up to do the proper things for their proper age group and all of that.
Yes, they are.
And so that's why I think, you know, if you do get something done at a pharmacy, you should write it down and instantly either go on the portal if you have a portal, tell your doctor I got this vaccine, be done with it. They have it now in their system. Or sorry, my clock is going off in the background. I apologize. Or just, you know, take that information in with you the next time to give it to them so they can put it in the you know, electronic medical record, and then it'll be condensed or, you know, compiled all in one spot.
I mean, this just speaks to being your own advocate too.
Self
We have to
self-advocacy.
take care of ourselves and manage our own stuff these days. It's just the way it is. So, yeah.
But
So,
the
yeah.
one last thing I'd really like to stress, though, is just, you know, the whole idea that, you know, vaccines don't prevent you from getting the disease sometimes,
Yeah.
like the flu. It really prevents you from being seriously ill or dying from them. And I think that's the main thing that I really want to stress, because so many people, well, I'm not going to get the flu shot this year because I got the flu, I had the shot and got the flu and blah, blah, blah. It's just not the way. It's just not being educated on how these things actually work. And I think as we see with COVID, at least we have, it's a more fresh idea in our mind that those that got vaccinated and then still got COVID, they had a much less, unless they have other underlying issues, that it was much less, and it's just better off that way, and it just unloads the healthcare system so they can't be overwhelmed, as we saw.
Mm-hmm. Yeah, so Beth Barnett says a medical record doesn't really answer questions about why. I was in one medical and they sent me an email to come pick up a colored test with no information. Wow. Beth, maybe you can expand on that.
Oh, Cologuard.
Cologuard.
Oh, sorry, Cologuard. Okay, thank you.
You
Probably.
can just watch TV for that answer. No, I'm just joking. Honestly, I think that the doctor should explain all these things for you. I mean, if not, I would question and be your own advocate and keep pushing for those answers. I mean, if something doesn't make sense or not well explained, push them on it.
So
Okay, go ahead.
I wanted to share that I went to the one medical office and I was told that that email was sent to everyone 45 and over.
What?
The email telling people to pick up a Cologuard test, there was nothing attached to the message that it said my doctor wanted
Wow.
to do this, and there was no, I mean, they're wonderful patient education documents, you know, that they could have just adopted from the government to explain colon cancer screening and why it's important, and how the Cologuard test works, you know, how you take it at home and how
Right.
it's different from a colonoscopy. So they didn't even have to write anything.
Yeah.
Just sent an email. So this is my concern, if we
Mm-hmm.
rely on the medical record to send the
Yeah.
reminders. The doctor's office, or in the case of one medical, a large medical system, doesn't have one who's thinking about this from a patient education point of view.
Were you able to give them that feedback? Like, did anybody?
I did. I went to the office.
Okay, good. Good. Yeah. Yeah.
So
Yeah. I mean, nothing's perfect out there. I mean, I guess I'm happy that they're trying to get people to do screening.
It's screened, but yeah, that needs to be done appropriately. And there should be a in-person conversation about options, not an email,
Right.
because that's an important decision to make.
Yeah.
one way or the other, right?
Right.
Yeah.
Anything else? Any other questions, you guys? We want to make sure and thank Dale for jumping on. She was supposed to be off this week, but
I'm a participant in the meeting, like
I
anybody
see
else.
that. I know. I love that.
Yeah.
Changed your role.
That's right.
Yeah. Well, so the other thing is if anyone has further questions, once we're finished, we're not done yet. Chris said he'd be happy to answer. We can, just send them to HealthAdvocateX and we can answer those. Patsy says about communication, I recently shattered my femur, ended up in a local rehab center where they decided they were going to give me all sorts of immunizations. They would not check with my primary doc. I finally insisted they call my pharmacy because they wouldn't believe my COVID cards and records. Wow. They did. And in that way, my immunization record, such as it was provided. Wow. That's so weird. Why wouldn't they believe your card? Oh, you're on mute. Sorry, Patsy.
Yeah, interesting. I wonder, and I don't know enough about this and I don't want to cast aspersions, but I wonder how much money rehab centers get for providing some of these things that maybe you don't need. But anyway, it was interesting. Yeah.
Well, good for you for not just going along with the.
Well, and I guess my point is that there are lots of places where this information is, but the question is who's searching them out, and can we as patients do that when we're under duress? Do you know what I mean?
Yes.
And so it gets very complicated, and that's all I know as a patient who tries to advocate for herself and others. So
yeah, and that's why I think just actually having a list either on your phone and things like that. But if they don't believe it, like you're saying here, that's a whole different issue where you have to force the advocacy of yourself. And it's really hard to do when you're sick. And I think that's one of the things that I think most patients would benefit, or it's been shown that they benefit from having an advocate, either a family member or a professional advocate, be there while they're sick. Because, when you're sick, you're not thinking clearly, you're not making the best decisions, or you're not thinking of all the different consequences and, possible outcomes. But no, good for you though. I'm really happy for you that you were able to do that.
well, and I just have found the conversation interesting about trying to get the information from the pharmacist to the doctor, and then from wherever you may end up, like in emergency or a rehab center or whatever. So it's complicated.
Yeah. And you're not going to have an advocate there 24/7. If these questions come up at a time where even if you had an advocate, they're not there. So
Exactly.
But it is important whenever possible to take anyone, because, they can help advocate for you. So.
Yeah. Beth, did you have another question?
Beth
Some-
Barnett.
But I was wondering, Patsy made me want to ask Chris a question. Is there harm to getting another dose of a vaccination when you've already been vaccinated at the recommended level?
I honestly don't know that answer. I mean, I can give you my personal thought, but I don't know officially that answer.
Depends how you define harm, right? Because there's pain and there's potential side effects.
Because your reaction is going to be greater and greater after injection. So I think it's possible that way. There was one story I remember reading the news. There was someone in Germany who received 150 COVID vaccines because he was selling the COVID cards.
Oh.
And I don't know what the outcome of that is. But that was just a story that stuck in my head because it was such a weird story. But no, I mean, there probably is not that much of harm except for the local reaction site and feeling bad for 24 to 48 hours afterwards with flu-like symptoms. That would be my guess, but I don't know of anything, scientifically proven.
Yeah, and if you're passy in rehab, that's the last thing you need, is to feel like you've got the flu,
Yeah.
right?
Yeah, exactly. Plus,
Yeah.
I just didn't want another bill.
Right.
That as well, yeah.
Well, thank you, everyone. Thank you, Chris, so much for presenting the information. And we will get out, Chris, a list for what the CDC recommends. She's on here. We can make sure we get that out to the folks that were on the call. And we hopefully will see you at our next event. We have a case review, Chris, on, let's see,
September
September,
20
I think it's the 22nd or 23rd,
It's the 22nd.
22nd. And that's our next big event. So we're all looking forward to seeing whoever can attend that. And thank you for coming. I'm sure Ashley will be sending out a post survey, so look for that in your email. And enjoy the rest of the day.
Yes.